A ešte odzinku vydržíš.
My wife is smiling because I play football for all my life.
Moja žena sa smeje, lebo hrajem futbal,
Now I have a small break because of my knee.
a teraz mám prestávku, pretože mám problém s kolenom.
Just like normal football injuries.
Je to normálne pri tých futbalových zraneniach.
And when we go somewhere for a walk, like to the mountains, or if we visit some big cities or something,
A keď chodíme na prechádzku,
and it's like 6 o'clock, and you don't have enough force to go for a train or somewhere, but you're exhausted and you would like to come back to the hotel.
a teda keď už o 6 ste unavení a nemáte už náladu ísť na vlak,
I asked her to do this from her liver. She needs to create some forces from the liver.
Že chcem, I guess this is what she's saying forward, right?
Just for one topic.
Že my to asi tak nepovieme, ale že chcem od nej, aby proste si siahla na dno síl.
Nadnosil. And nadnosil, it means in Poland that we call it take this energy from the liver
Pôvodne povieme, že vytiahnu tú energiu z pečene
or from below of the liver.
alebo spod pečene.
Spot pečenie means it's really clear, it's clever.
A je to povedané chytré,
Because when your effort is much more than 45 minutes, you probably know that you are trying to reduce a fat
pretože keď nad 45 minút začnete páliť tuky,
to create energy because you can exchange it into the sugar.
vytvorili energiu, ktorú použite ako cukry.
And the most basic storage of fat is liver.
A teda najlepším a najzákladnejším zásobiskom tuku je pečeň.
Is it?
Je to tak?
So, if we create it as some observation in our practice,
Keď budeme pozorovať v praxi,
so you will, to sa upozorujete,
budete pozorovať,
že taký ten tvoj pacient,
že
he will come to your practice and he will say that he has no energy,
príde pacient bez energie,
means maybe that the circulation and tensions around the liver are blocked.
asi to znamená, že cirkulácia a napätie okolo pečene je zablokované.
And he can't get this energy and use these processes of
A teda tento pacient nevie mobilizovať
to get free this energy from fat.
tie energetické rezervy z tukov,
But maybe it could suggest you that because of lack of activity in his life,
a teda kvôli nedostatku aktivity v živote,
maybe this amount of fat around liver is too big.
je tá pečeň stukovateľná.
And it means that if the patient will come to the ultrasonography diagnosis,
A keď príde pacient na solnopečenie,
there will be everything perfect, almost perfect.
je všetko super,
There will be only one statement that there is a small amount of a fat around the liver.
a teda bude tam iba popis, že je malý obnos tuku okolo pečene.
All blood tests will be okay.
Krvné testy budú v poriadku.
This ALAT and ASPAT, levels will be v poriadke.
Tieto pečeňové hodnoty budú v poriadku.
This I think it's Russian. Все в порядке. Очень хорошо.
I don't do this language yet.
Очень хорошо. So we call it in Polish delikatne stłuszczenie. It means that it's
to hovoríme, že to jemné stukovatenie.
Stukovatenie of the pečeník.
Čisté.
It means that this patient eat too much, especially sugar,
Čiže ten pacient pravdepodobne dáva do seba veľa cukru.
with totally lack or very small amount of activity.
množstvom aktivity.
So I mean now to get your energy below your pečenie,
A teda chcem, aby ste vytiahli energiu z pečene
and it's the last 1 hour.
a tú poslednú hodinu.
When we think a little bit about such simple story that I created,
A hovoríme o jednoduchých príbehoch.
it means that in our normal life we use some sentences that are very, very logic
Využívame takéto logické porekadlá,
when we think about anatomy and physiology.
keď myslíme na anatómiu a fyziológiu.
So it means this pečenie gives you energy or gives you lack of energy.
A pečeň vás môže obdarovať energiu alebo vám ju zobrať.
Depends on which state of this liver is.
V závislosti od toho, v akom stave je.
It means depends on which, in which situation you are, diabetic situation and the same activity situation.
Musíte zistiť, aká je tá stravovacia situácia aktivity.
We're coming back to our lumbar and sacral spine, and you suggest us about your lumbar sacral spine that there is something strange.
No, teda, ak niečo tvrdí, že tam v tej krížovej kosti je niečo čudné.
And we remember that this sacral bone is like a triangle shape.
A som si
Actually, it's
spomenul,
not.
že sakrum je takého trojuholníkového tvaru, aj keď to nie je.
Became from knitting together 5 pieces of sacral
A vznikne zrastením 5 krížových stavcov.
We have anterior and posterior surface.
Má prednú a zadnú plochu,
We have the base, which is
hore má bázu,
directed in direction of the
v smere
head,
hlavy, v kraniálnom smere má
and in
bázu
sacral direction there is an apex,
a v kaudálnom smere má apex,
which is connected with coccyx.
ktorý je spojený s kostrčou.
Sometimes we can see some strange situation. Of this slide.
Môžeme vidieť takéto čudné situácie.
It means that lateral part of the last lumbar spine vertebra is connected with lateral aspect of the S1.
Čiže tu môžeme vidieť prepojenie medzi laterálnym aspektom S1 a L5.
What is very characteristic is a situation when we could recognize that we have a lack of 20% of mobility of the lumbar. Yeah?
Kde vidíme, že tam chýba 20% rozsahu tej driekovej chrbtice.
Because we have like 5 spaces between and 5 joints between.
Ak máte teda 5 priestorov a 5 klbov,
In this situation is something missing.
Niečo tu chýba v takejto situácii.
It could look exactly similar in patient after surgeries around lumbar spine.
Podobne u pacientov s operáciou okolo tej driekovej chrbtice.
Imagine that in a situation where when this disc is destroyed,
A teda v prípade, keď je tam poškodený ten disk,
if this circle was destroyed and this nucleus bulbosus go out
a
partially,
nukleus je poškodený, takže nukleus bulbosus čiastočne vychádza von.
it means that we need operation
A potrebujeme teda operáciu,
to grab it away.
aby sme to
Nucleus.
aby sme vedeli ten vytečený bulbosus odňať.
So we stayed only with a cover of this disc.
Čiže budeme pokrývku toho disku.
It will be like this amortization in suspension system without oil inside.
Čiže bude to ako tlmiče v aute, ale bez oleja vo vnútri.
So it means that it will not funguje.
Čiže to nebude fungovať.
In this situation, you will overload a level up.
V tejto situácii preťažíte to úroveň nad tým.
You will overload by mobility because you will mobilize
Budete tam mobilnejší
much more this area.
v tejto oblasti.
And the same, this area will be overloaded because of
A rovnako táto oblasť
cancelling vibration,
bude
absorbing vibration.
preťažená absorbovaním tých vibrácií.
Okay? So it means that after this surgery there is symptoms will be much better.
Po takéto operácii tie symptómy budú lepšie.
After like 2-4 months from the surgery, everything will be almost perfect.
2-4 mesiace po takéto operácii bude všetko fajn.
But after 2 or up to 4 years,
Ale medzi 2 a 4 rokmi
I'm almost sure that this level will look like totally similar to this one
tento segment
this 2 years ago.
pravdepodobne tiež problém ako ten segment predtým.
We could of course protect this patient from this story.
Sa snaží tohto pacienta pred takýmto scenárom uchrániť.
When you have a patient after surgery on one level, you need to create such story and explain what does it look like.
No, musíte tomu pacientovi vysvetliť, že keď už tú operáciu mal, že ako to bude vyzerať ďalej.
Try to explain to this patient that in his car only 3 wheels are in good air pressure.
Musíte mu vysvetliť, že v aute má dobre nafúkané len 3 pneumatiky.
And one is totally like a flat and
A jedna má defekt.
Okay, what else? In this situation is totally stiff.
Takže toto sa nebude hýbať.
After this injury that I create, sorry that it goes out, there is some small mobility.
Po takomto zranení tam bude nejaká mobilita.
But because of lowering down this disc,
Ale kvôli zníženiu toho disku,
you will observe on RTG, for example, that there are some osteophytes
budete vidieť aj osteofity
on corpuses of the
na
spine,
telách tých stavcov.
and sometimes it will be connected, especially in the older age.
Niekedy sa potom v tom staršom veku tie osteofity spoja.
So at the end, it's like a totally stiff.
A teda na konci dňa to zase bude.
Sometimes, yeah. Sometimes you can see the opposite situation.
Niekedy môžete vidieť ale opačnú situáciu,
That during this sacral bone becomes something,
kde
some
počas
fibers miss.
zrastania tej kryčovej kosti niektoré vlákna začnú chýbať alebo budú chýbať.
So we can see that it's something like this region is naked because of lacking of bone.
A budete vidieť, že tam teda chýba tá kosť.
Is it real naked? No,
Je tá?
because on the anterior aspect there are, for example, anterior longitudinal ligaments.
Tá kosť tam to nebude vidno, že tam chýba, pretože na tom prednom aspekte sú anteriorné longitudinálne ligamentá.
So this space is covered,
A ten priestor je stále pokrytý,
but not as safe as it there be a bone.
ale nie tak bezpečí, ako keby tam bola kosť.
Then you can add some ligaments between sacral bone and iliac bone, sacroiliac one.
Predstavte si sakroliakálne ligamenta,
It goes really in huge amount of fibers.
ktoré majú teda veľa vlákien
So it's covered also there.
a tiež to pokrývajú.
So it's not naked, but
Čiže nie je to úplne obnažené,
sometimes such situation became.
ale niekedy sa táto situácia môže nastať.
When we will be interested in sacral bone,
Keď budeme mať záujem o krížovú kosť,
this sacral bone is fixed between two iliac bones,
tá je zafixovaná medzi dvoma iliami.
and we have something like joint,
Môžeme to nazvať esipodom,
but it looks like a very specific joint
ale je to veľmi špecifický klb.
because of small number angles of mobility.
Má veľmi málo stupňov mobility
Sometimes we create some statement that it's not mobile.
a niekedy tvrdíme, že to nie je mobilné.
In articles that I was shown in my topic of pelvis, it was like 10 years ago.
10 rokov dozadu som čítal článok o pánve.
Doesn't matter. There was a guy which spent the whole life in this topic of sacroiliac joints.
Autora, ktorý tým strávil celý život.
And he was from Belgium.
To bol z Belgicka.
He was an academic teacher from some university.
Tiež bol učiteľ.
And he showed us like, I don't know, maybe 30 articles that were quarrel each other, what's the amount of angles, what the amount of millimeters.
Teda porovnával asi 30 rôznych výskumných prác na tému uhla a milimetrov pohybu do sakrilegálneho klobu.
And at the end he states that, as you can observe, there is no mobility that you can use in your practice.
A nakoniec konštatoval, že nie je tu mobilita, ktorú viete využiť v praxi.
So one of the guys that was sitting on the next table from mine asked him, but do you work with this joint or not as an osteopath?
A teda žiak sa ho spýtal, či teda s týmto klubom pracuje ako osteopath.
And he said yes, every day.
A povedal, že áno, každý deň.
He was in the end of my studying osteopathy, I could conclude that the mobility is very small.
Na konci môjho osteopatického štúdia by som povedal, že tá mobilita je malá,
but elasticity exists.
ale elasticita existuje.
So it means that I need elasticity to absorb shocks,
Určite potrebujem elasticitu na to, aby som vedel tlmiť nárazy,
to create sometimes strange movement like a leg to the top or
aby som vedel robiť rôzne pohyby,
like during playing a football or something, to jump to the air and fall
aby som
down
mohol skákať a dopadať.
on one leg, etc. I need this mobility.
Tú mobilitu budem potrebovať.
Maybe I don't need elasticity. Maybe I don't need mobility.
Možno nepotrebujem tú mobilitu, ale určite potrebujem tú elasticitu.
The same about treatment.
A to sa týka aj terapie.
We need to imagine that if you will open some articles in what is the real mobility in this joint.
A ak si otvoríte článok na tému, aká je mobilita tohto klobu,
Sometimes you will see that if you are observing anteriorization and posteriorization,
budete sledovať teda predzadný pohyb sakra,
it means the nutation and
čiže nutáciu a kontrakciu.
nutation of the sacral bone. You will observe that there are some observation. There could be 2 millimeters.
Neviem, povie, že to môže byť až 2 mm.
But 2 millimeters, when you observe that are soft tissues, and then you grab the sacral bone and trying to get these 2 millimeters
Budete chcieť získať
observation,
2 mm pozorovania,
it's very difficult.
to asi je veľmi náročné.
But when you will work with sacral bone,
Ak
you will
budete pracovať so
see
sakrom,
the real changes in the body statement,
uvidíte skutočné zmeny.
in his feelings,
Takisto sa budete cítiť aj pacient.
in some comfort of staying and walking after
Budete mať
this.
komfort v stoji a v chodzi.
And I'm sure that you will observe like on your each bodies when you will have pelvis lectures.
A teda uvidíte to aj, keď budete riešiť viacej pánov.
To create it in proper way, you need to grab properly sacral bone and it will be our task.
Teda budete potrebovať sa vedieť uchopiť na tej kosti, zachytiť tú kosť.
The same about coccyx bone.
A to sa bude týkať aj kostrče.
We need to know how to palpate it
Potrebujeme vedieť, ako
and
tú
we need
kost
to feel
palpovať
it.
a potrebujeme tu ju nacítiť.
And then whatever you just create and think what technique you create,
Budete robiť, uvažujte, aké techniky tam budete robiť.
it's a small problem. You need to grab it first.
Potrebujete vedieť najprv tú kosť chytiť.
Yeah, and when we would like to compare this lumbar and sacral bone, remember that there is a huge, huge mobility on the lumbar that is a stiff sacral bone.
Čiže máme v porovnaní veľkú mobilitu drejkovej chrbtice oproti tuhej krížovej kosti.
Both support whole spine,
A obidve podporujú celú chrbticu.
and if it's such big mobility connected with a stable sacral bone,
A ak je tam veľká mobilita a zrazu tá mobilita nie je v porovnaní s tou krížovou kosťou,
means that there are huge problems.
znamená to, že tam je potenciál pre problém.
When we would like to be focused about this region, remember that sometimes it's a very characteristic pain and stiffness that you just palpate during the therapy.
Budete cítiť nejakú charakteristickú túhosť počas tej terapie.
And you will see that all these muscles are stiff and tense.
A budete vidieť, že tie svaly sú všetky napnuté.
Not only them, but also thoracolumbar
A
fascia.
nie len oni, ale aj thoracolumbar fascia.
And there will be some connection in this area, like a crossword.
Až teda budete mať nejakú krížovatku tých spojení.
Crossroad. As we mentioned about latissimus and pec and gluteus maximus,
A ako sme spomínali, to spojenie s gluteus
you can see these fibers. It's the one line,
maximum a ďakujem. Vidíte tie vlákna?
and it's connected to each other.
A
And
čiže
it's
spojené.
so it was this chain that I suggest you: painful shoulder and knee hip on the opposite side.
A teda budeme hovoriť o tom kolene alebo bedre na opačnej strane ako spojení s tým ramenom.
You remember from yesterday when we draw it, it was transversally here, and it was almost horizontally here.
Čiže keď sme to včera kreslili, tak to bolo skoro horizontálne tu a vertikálne niekde tu.
And all these fibers are connected with iliotibial tract.
A všetky tieto vlákna sú spojené s iliotibiálnym traktom.
When we are talking about deep muscles,
A keď hovoríme o hlbokých svaloch,
these are very interesting when we go really, really deep.
je to zaujímavé, keď pôjdeme do hĺbky,
Because this normal erector spine is a little bit boring muscle.
pretože ten erektor je pomerne nudný
It's a stupid one.
a hlúpy,
Because he goes to extension and he blocks everything.
kvôli tomu, že ide do extenzie a
She's
všetko
like
zavrie.
a hero, Captain America,
Cíti sa ako kapitán Amerika,
but without enough cells in the brain.
a bez mozgových buniek.
Yeah, let's move over. So it means that he just creates a stiffness because of something and he doesn't know why.
Bude vytvárať nejakú túhosť bez toho, aby vedel prečo.
Therapies in this erector of spine often are lack of effectiveness,
Terapie v tejto oblasti nemajú veľkú efektivitu,
but probably you can recognize that often this erector of spine is totally stiff and is blocked, it's painful, and the patient feel much better after some, massage
a
of it.
tí pacienti sa cítia častokrát lepšie po nejakej terapii,
But the erector of spine is an effect.
ale je to len výsledkom.
Effect especially when we talk about the multifidus muscle,
Keď hovoríme teda o multifide,
thoracolumbar fascia,
trahale fascii
and transversus abdominis.
alebo transverzia abdominis.
So the erector would like to help. If somebody just almost collapsed,
Tie erektory tomu chcú pomôcť, že keď vám ten pacient kolabuje,
Captain America comes
príde kapitán Amerika
and support everything
a
by blocking.
všetko bude udržať.
Yeah? So we need to recognize this erector that it's only an effect.
Čiže potrebujete rozoznávať tieto erektory, že sú len výsledkom takéhoto
So the
schopnosti.
hint is to find the multifidus
Čiže budeme chcieť hľadať multifidus
and create therapy around him.
a budeme robiť aj terapiu.
Maybe sometimes about the there will be it's hidden. It's not shown because it's a little bit deeper. Quadratus lumborum.
A teda aj quadratus lumborum.
So this quadratus lumborum will be somewhere between this oblique one and it will be like in this area it's cut.
Teda QL-ko bude vyrezané v tejto oblasti.
So at this situation we are thinking about these deeper muscles
Tuto budeme uvažovať o tých hlbších svaloch,
and these are much more effective.
ktoré sú efektívnejšie.
So at this moment I will state that
A mohol by som povedať, že
when you are interested in some region, think about deep structures, not superficial.
keď vás zaujíma nejaký región, tak uvažujte o tých hlbokých štruktúrách, nie o tých povrchových.
So when I suggest you about some problems about shoulders,
A teda keď hovoríme o ramenách,
I don't know when last time I do anything with a deltoid muscle.
No, a nepamätám si, kedy som naposledy niečo robil s delťákom.
To be sure, maybe 10 years ago.
Aby som mal pravdu povedať, tak možno 10 rokov
I'm not touching it, it's like without almost no rule.
Zvyčajne sa ho nechytám.
But when you will ask me what about subscapular and pectoral
Ale keď
muscles,
sa budem baviť o subscapuláre a pectorále,
it's almost every day I'm doing some therapy about around these muscles.
takmer denne na tom pracujem.
It means that if something is superficially, it's for mobility
Keď je niečo povrchové,
and may be protected.
súvisí to viac s mobilitou a ochranou.
This area which is injured and overloaded.
A táto oblasť častokrát bude preťažovaná a zranená.
So the same about latissimus dorsi.
Rovnako aj latissimus.
I don't remember exactly when I was working with it.
Nepamätám si úplne presne, kedy som naposledy s latiakom pracoval.
I can't give you the reason why you should do this.
Neviem vám povedať, prečo by ste s ním mali pracovať.
And opposite, there will be many indication to create some therapy for multifidus and quadratus lumborum.
A tiež budú indikácie skôr pracovať s multifidom a kvadrátom.
Yeah, and when we are thinking, for example, about there's quadratus lumborum. It's huge.
Tu vidíme kvelko.
When we think about transversus abdominis and multifidus muscle and its function,
Budeme transverze a multifide a ich funkcií,
and how to activate them,
ako ich aktivovať.
we will get the answer who and which muscles are the most important for stability of the lumbar spine.
Získame predstavu, že ktoré svaly sú dôležité pre stabilitu valnej chrbtice.
To have and to stay with good condition of my lumbar spine and maybe sacrolumbar spine.
Aby sme zostali v pohode v LS prechode,
I need good condition transversus abdominis and multifidus muscle.
potrebujem dobrý stav transverzu a multifidu.
So it's why when you work, for example, ladies, when you work with some urogynecology problems,
Čiže keď pracujete s urogynekológiou,
often you are interested in pelvis floor tensions,
častokrát vás zaujíma napätie pánvového dna,
which are totally connected with multifidus and totally connected with transversus
ktoré je aj
abdominis.
tak spojené s transverzom a multifidmi.
It's why you teach your patients to breathe in and breathe out correctly
Dôvod, prečo chcete, aby tí pacienti správne dýchali,
with activization during breathe out of a transversus abdominis,
a s aktiváciou transverzu počas výdychu,
which need to be together with pelvis floor.
čo musí byť v spolupráci s pánvovým dnom.
If not, you will give some big tension of the transversus and like
Ak nie, tak budeme veľké napätie transverzu a vypadne na dnu.
we need a balance of the pelvis floor. It can't be too tense and it can't be too weak,
Takisto to nemôže byť príliš napnuté, ako to nemôže byť príliš slabé,
like a trunk next to the barrier.
ako pilec vedľa vás.
I will do it myself. Don't be afraid about it. It's like this. Okay, how to activate these muscles?
A ako tieto svaly aktivovať,
Especially I'm asking you how to activate multifidus muscle.
alebo zvlášť ma zaujíma, ako budete aktivovať multifidus.
Do you know how to create some activity of them?
Viete, ako vytvoriť ich aktivitu.
Can you show the picture? Which is it? Which one is it? Which one?
Multifidus? Multifidus is this one.
Okay.
This is multifidus. What? I would like to create a tension only in these fibers.
Chcem len ten multifidus napnúť.
It's like a multifidus. What? Yeah, how to straighten it?
Can I just like tell the patient to try to si pacientovi, aby si zkusil jako oddálit hlavu od zánvek, aby se tak načinil.
Like this? No.
When you're lying.
There's a very nice hint. There is a nice book. I'm almost sure that I'm not sure. Maybe it's translated into Slovak or Czech language. There is the Evgen and somebody else. Evgen is the main author.
Hlavný autor.
There's a kinesiotherapy in a stability of a sacrolumbar complex.
Volá sa kinezioterapia pre stabilitu sacrolumbalného komplexu.
This kinesiotherapy means like old language and old school. Right? But it's a kinesiotherapy which based on experiments.
Je to kinezioterapia založená na experimentoch.
Unfortunately, on a pigs and rats, and they were irritated by power or something.
Prasaták a potkanoch.
And I don't like such
A
experiments,
takéto experimenty sa mi nepáčia.
but I eat meat. But okay, come back. There was some suggestion that when there was some sensors put it in a body of a pig,
A teda napchali tam senzory
and they were trying to observe in which of activity of the pig
a snažili sa vnímať, že ktorá aktivita alebo ktorý pohyb toho prasaťa
turning on multifidus muscle.
zapne multifidus.
And there was really clear observation
Bolo to pomerne jasné pozorovanie,
that during deep breath out,
že počas hlbokého výdychu
turning on transversal abdominis,
sa zapína transversus
totally in the same part of the second with
v
multifidus.
rovnakom čase ako multifidus.
So when you create breath out with tension of transversus abdominis,
A keď dáte výdych s napätím transverzu,
this muscle is turned on and it works really effectively.
tento sval sa zapne a pracuje efektívne.
There was some observation that states that when you turn on this transversal abdominis, like a small breath out
Teda keď spravíte malý výdych
and tension of transversal,
a
means
transversus,
that you just turn on multifidus and you are almost stable.
znamená to, že zapnete aj multifidus a ste takmer stabilní.
Yeah? Do you understand?
Čiže keď držím zaťaté brucho a vydychujem,
Yeah.
Definuješ
You
aj
need-
brucho, ale áno.
You need a position like breathing out.
Čiže potrebujeme
Not like-
v tom výdychu, či nie nádychu.
I need like this, and when I imagine my position with some small breath out, now I can breathe in and I can run and I can hit the football and etc. But in this position, I am safety because of stability of the lumbar
V
spine.
tejto pozícii budeme bezpečí kvôli stabilite
Yeah,
dýchovej
do you
chrbtice.
understand? Because this multifidus is like a general muscle that creates a stability of the lumbar spine.
Multifidus je všeobecná stabilizácia.
Stability, it means the proper position.
A to znamená, že nie je stabilita ako taká, ale stabilita v tej správnej pozícii
Between these vertebrae.
medzi tými jednotlivými stavcami.
Yeah, you understand? So we need to train it in some izolowane,
Musíte to trénovať v izolácii,
isolation like during lying, during crawling position, etc.
alebo na štyroch.
And if you train it, you can go for a run.
A ak to máte natrénované, tak môžete bežať.
But your patient need to feel what's going on, how to
Ale pacient
run
potrebuje
with activization of transversal and multifidus.
vedieť zaaktivovať.
Yeah, it's good hint. And imagine now that your patient come from the orthopedist with this belt.
Pacient príde teda s bedrovým pásom.
What a fucking good idea
Taký super nápad.
to create some pressure outside
Vytvoriť vonkajší tlak
and turn off all these muscles.
a vypojiť tieto svaly.
Then you will move this belt and
Dáte si ten pás preč, potom sa rozpadnete.
I think it's stupid. When I have patient in acute state,
Keď pacienta v akutnom stave.
I'm trying to explain that when you are using this equipment after car injury, if you use this equipment because of the pain of the lumbar spine,
takéto ortézy.
okay, I can agree that when you are going by car with your friend to go to my clinic,
Súhlasím, že keď
you
idete autom,
can use it.
môžete to asi použiť.
But normally when you are going
Ale keď normálne fungujete
in
v
your
živote,
house and you have free time now, just be focused on your body.
a skúsite sa
Try to
sústrediť na
not
to telo
use this equipment
a nevyužívajte tieto vybavenia,
if it's not hardly necessary.
ak je to naozaj, kým to nie je naozaj nevyhnutné.
Because if there is, for example, a fracture of the vertebrae,
Ak je to treba zlomenie stavca,
if there is, I don't know, maybe some osteoporosis, etc., and I can't move because
osteoporóza a ja sa nemôžem hýbať,
and it's already broken,
lebo je to už zlomené,
I need to wait for a while.
potrebujem chvíľku počkať.
But at the end, also in this osteoporosis, I need overloading a body. I need kilos of gravity
Potrebujem pretržiť to telo,
to rebuild the bone.
aby som znova vystaval tú kosť. Teraz je
When you are lying, you lose your bones.
Ale čo potom, keď to telo nie je tak pripravené na to preťažovanie, či to nezvládne? But what if the body is not supposed to be
After this immobilization,
yes, but
you need to do step by step. Yeah?
yes, but not overload.
Yeah. You need to just in lying position. You need to do some exercises. You need to, yeah. Exactly. I'm sure.
Potrebujete začať pomaly a
I'm talking about a situation that
ale hovorím o
many patients they have just some radiculopathy.
situácii, kde pacienti majú radikulopatiu treba
They have hernia of disc.
a majú herniáciu disku,
Not big problem actually.
čo nie sú teda
They
veľmi
use these belts.
ale používajú takéto pomocky.
It's sad.
To je smutné.
Okay. What about this lumbar spine?
No čo triková krtica?
Remember that is some correlation between this abdominal wall and the lumbar spine. So we suggested that transversal is important here.
Vieme, že tu nejaká korelácia medzi brušnou stenou a chrbtom a či tu bude dôležitý ten transversus.
And the same about all these muscles that we create a statement it's abdominal wall
A to sa týka aj tých svalov, ktoré vytvárajú tú abdominálnu stenu.
are correlated with this lumbar spine, especially thoracolumbar fascia, which we will describe next
Tiež
week.
sú viazané v tejto rakolumbálnej fascii a to budeme popisovať o týždeň.
And to recognize which muscles are the most deeper in this region, sacrolumbar.
Aby sme videli, ktoré svaly sú v tomto lumbosakrálnom regióne.
So I'm asking which are the deeper, which are the most important.
Ja sa pýtam na tie, ktoré sú tie hlbšie a tie dôležitejšie.
You have an answer. It's a clue. Psoas, iliacus, quadratus lumborum.
Iliacus a quadratus.
So when you are focused on the lumbar spine,
Iba sa má drieková krtica
but from the field of the muscles,
z svalového hľadiska.
so the most important to create good effectiveness in your therapy is to focus on them.
Najlepšie bolo v tej terapii sa fokusovať na tieto svaly.
So when I could choose only 3 steps
A keby som si vybral iba 3 kroky
in topic of svalovs,
Svalov. V oblasti svalov.
z oblasti svalov, muscle, yes,
svaly muscles, right? Okay.
svaly.
Svaly.
Svaly. So from the all svaly in this region,
Zo všetkých
these
svalov.
are the most important.
Toto sú tie 3 najdôležitejšie v tejto oblasti.
Yeah. You could create many, application of tapes
Môžete aplikovať tapy
for this region.
na celý ten
You
región.
can massage this erector of
Môžete
spine.
namátkať tejto erektory.
You can add some tapes also for the
Môžete tapovať
oblique muscles.
a šiknú brušné svaly.
Maybe you will get some tapes for rectus abdominis to create smaller
A rectus. aby ste zmenšili diastázu.
hernia, diastasis, yeah? But it's lack of effectiveness if you will not turn on this transversus to create stability.
Nebude to efektívne, pokiaľ nespustíte transversus do
But if you
stability.
would like to create some statement that it's possible, this stability,
No ak chcete povedať, že tá stabilita je možná,
je to možné, jak zrelaxujete tie svaly.
a až keď zrelaxujete vlastne tieto svaly.
Okay? At the end, you could create some statement that these are really deep.
Nakoniec tieto svaly sú pomerne hlboké,
It's a psoas muscle, it's quadratus lumborum, it's erector spine.
to sú erektory.
Then there are some fibers that are connected together in a thoracolumbar fascia.
Potom tu máme vlákno spojené do thoracolumbalnej fascie.
Of course, it's connected with the crucis of the diaphragma, as we mentioned in the Little John model.
A je spojené aj s ramienkami bránice.
I described that in L3 there are forces generated by this crucis.
A teda podľa Little Johna v tej L3 budú sily generované týmito ramienkami.
So everything could create some nice pictures if you add all this my hints, my description, etc., etc.
Čiže nakoniec si môžem si postupne takto skladať tie nápovedy.
So at the end, I would like to palpate with you the bone, sacral bone,
Chcem teda palpovať sakrum,
xiphoid bone,
kostrč.
Kostrč. So we'll palpate kostrč and kost krzyżowa.
Áno, povedal kostrč, a budeme palpovať na sakre, budeme na xiphoid palpovať? Tak, bude to asi kostrč. You meant coccyx, right? You said xiphoid and that's the term.
No, coccyx.
Yeah.
Sorry.
Okay, no problem.
Coccyx and sacral bone.
Čiže budeme riešiť kostrč a krížovú kosť.
But before palpating this, because we've been thinking about this sacral bone generally, yeah?
Teda budeme hovoriť všeobecne o sakre.
I would like to ask you
Chcel by som požiadať niekoho.
and you, I think, yeah, to lay down on this couch and on this couch, and I would like from you to give some observation from the rest of the class.